A lot of people, including myself, will be called veterinary physiotherapists. That's not protected. Anyone can get a van, put vet physio on the side and go and drive round. So that's a little bit scary.
How would you explain vet physio to a lay person, like really quickly?
Really quickly. It can help to improve fitness, strength, function and rehabilitate injuries.
What would you like first opinion vets to know more about veterinary physiotherapy?
Oh, how long have we got?
Hey friends, welcome back to the channel. So today we have Becky Black,
Hello.
who is so kindly spending some time with us today to talk about veterinary physiotherapy.
Indeed.
Bear with because it's quite a hot day and we're kind of like sweating in this place. But so hopefully it'll be very informational and interesting for you today. So before we begin, just want to ask you a question. So Becky Black has a business called Horses to Hounds. Yes. So are you more horses or are you more hounds?
Oh, that's a good question to kick off. Okay. So my background mainly is horse-based. So started life as one of those horse mad girls. Had my own horse, didn't have a dog, didn't know any family that had dogs, anything like that. And then went to go and do equine science. Again, still being horsey. And it was only when I did my veterinary physiotherapy training that I started doing more work with dogs. I didn't particularly like the dog work. I was a bit scared of them, to be honest, at first. So even going through my training...
Wait, you're scared of dogs but not horses? Like horses are you?
Not so much scared of them, just they're so small. If you're used to leading horses up here, and then you go to a dog on a lead, it's a little bit different. I was a bit clumsy, basically. I didn't know where to put my hands, didn't know how to put a harness on. More embarrassed, I guess, than scared. And then, once I qualified, you become very open to whatever brings business in, and for the first 2 years at least, all I did was dogs. So the first 2 years out of qualification, I really just used all the professional skills. I didn't have any of the fluffiness of, oh, my little fluffy angel, you know, people will do with the pet dogs. So I tended to approach them a bit more professionally, a little bit more standoffish, and it's only after a couple of years that I built up that rapport.
And you're speaking in a high-pitched voice for the dogs?
Oh, dog voice. Yeah,
absolutely.
Dog voice is real. Dog voice is totally real. And then, I think as the business grew, even now, I probably do 60-70% dogs and then the rest horses.
Okay.
So it's very, very different, but I enjoy the difference. So I enjoy working with the different species, and they bring different challenges, different sporting sort of problems as well, and performance issues. So your agility dogs, kind of like show jumping horses a little bit, but they bring their own little challenges, which is nice.
So cool. I'm always so amazed by the amount of applications you can use veterinary physiotherapy in. And I feel like in uni, I don't know about you guys, but I feel like I didn't receive enough teaching around that subject. Like we knew about, the orthopedic diseases, conditions, and, musculoskeletal stuff, anatomy. And then physiotherapy was mentioned as like, a treatment option. But that was it. Like, they didn't really go into... Well, maybe I wasn't paying attention in class, but when speaking to my friends, even in practice, we would just refer to the physiotherapist. Like we wouldn't have a lot of information about it. So I find it really cool that you are teaching in Nottingham University as well.
Yes, I teach there as well part-time. So run Horses to Hounds physio as my predominant life, and then part-time teach on the Master's Veterinary Physiotherapy there as well. So they work really well hand in hand. So my lecturing helps with my business because I'm up to date with things that are coming out, and vice versa. Working with real life cases then transfers well into the lecturing side, where you can say, I'm still in practice, I'm still up to date with things in terms of a practical sense. I'm still doing massage and stretching and applying lasers and all these other things that then I can show students how to do as well. We are as well trying to filter down into the vets a little bit more. So we do some work with the preliminary year, up to year 3, and then a couple of my colleagues will do year 4, year 5 as well. So we're trying to integrate it into the vet studies and then help them all the way through their veterinary career to say, hello, vet physio is still here, and we're a really good adjunct to help this part of your course or at this point in time and that sort of thing. So trying to build some nice foundations for professional practice in the future.
That is so cool. Like before I even applied to vet school, I never knew much about other animal careers, careers that you can help animals in. So like veterinary, like nursing, veterinary physiotherapist. So I really want to know how you got into all of this in terms of like studying specifically for veterinary physiotherapy.
This is really interesting. So I probably would say it's a new or an emerging type of career path. I say new and emerging, but I've been in there for nearly 10 years. So
10 years?
Well,
Wow.
nearly. So it's not quite as new as people would think. But I think the media and things are now catching up with, hey, there's a really cool thing that people do, which is veterinary physiotherapy and can help with rehab, and hydro's a lot more prominent now, and there's all these different things that are popping up over the place which can help. So it's new, I think, to a lot of people, but it's old hat to people that have been in the industry a long time.
Right.
But certainly when I started off my career, I wanted to be a vet. So I started off with, that's all I want to do, I just want to be a vet. Unfortunately, I didn't have chemistry, so I had to go the long way around, and I thought, well, we'll do an extra year at uni, do an equine science undergrad and build my way up and eventually get to vet school. By halfway through, I thought, hang on a minute, this is going to be 9 years in the pipeline before I get there. So I had a bit of a change of tact. Went to go and speak to one of my lecturers who just happened to be running a vet physio course as well, so he did part-time, and said, oh, come along to the open day, come and see what it's all about. And I thought, oh, well, I don't really want to. I don't want to do that.
Right,
I didn't know enough about it. Like you said, people just don't know enough about it to
Yeah.
say whether it's good or bad, or whether it's regulated, or how
exactly. Yeah.
sort of good it is. Is it reputable?
Or is it like a sustainable career? Like lots of people are wondering,
what's going on with it? Is it just something that's a bit of an adjunct, or can I make a life out of it?
Yeah.
So I went along to the open day, absolutely loved it. Found that I could do all the things I wanted to do as I wanted to be a vet. Having that one-on-one time with owners and the animals, spending time with them, seeing progression, helping cases, but it had a little bit more of that personal side. So I'm mobile, so going to people's homes as well, and you do build a really nice rapport with clients, and then you can feed back to the vets much easily. So it's a really key position to be in, to be able to speak to owners really openly, and also to the vets as well. And that's probably the side that we're trying to work on a bit more now, of saying, we know everyone's so overwhelmed in the veterinary industry, we're a good little adjunct to say, offload onto us a little bit and we'll try and help you. Raising awareness of it, doing that.
All the good stuff.
All the good stuff.
And I can't wait to get into if you are happy to share specifically on some cases where you found that was very rewarding, and how that progression, you can actually see a huge difference in patients. Because personally, for me as like a first opinion vet, I feel like I see the patient in that short 15-minute window, do a quick assessment. If it's something musculoskeletal, prescribe a non-steroidal anti-inflammatory, for example, and then I don't see them again for like a week or a couple of weeks. And I always wonder, like, if we had, obviously I know the answer now, yes, if we have like, physiotherapy, laser therapy, hydrotherapy alongside the treatment plan, things could have been improved faster, the animal won't be in pain quicker. So one of the questions, I don't know, did I interrupt you halfway? I feel like
no, I think so.
Okay. Yes, one of the questions I had on my social media, when loads of people are curious about veterinary physiotherapy, is what would you like first opinion vets to know more about veterinary physiotherapy?
Oh, how long have we got? That's a tough one. There's so much. It is changing. I think the veterinary field is changing. There's been some work done at the moment in Canada. So there's a paper by Kevin Housler which came out a couple of months ago, maybe even last month actually, which listed all of the problems that are currently in the industry and how hard it is for vets, essentially. The short consult times in retrospect of what we get. So my initial consult is an hour and a half.
What? No.
Luxury, I know. Yeah,
I would have thought like 30 minutes, but like
an hour and a half for the first one, and then it's usually my routine ones are about an hour.
Wow.
So if you think about how much you can do in that time, how much you can check. I mean, I say I can do a lot in that time. I think I must be quite slow. Well, I have a lot to fit in. So we pack a lot into that time. Yeah. But equally, we can feed back at several points back to the vet.
Yeah.
So initially, we'll do a bit of a gait assessment. So say the dog's been referred for arthritis in a carpal joint or something, okay? That's the problem on the list. Yeah. I usually disregard that for the moment and just look at the dog as a whole. So how does it function? How does the dog walk? What's the person's house like? So I mean, in here we have like some quite slippy floor. I'd be looking at the slippy floor and saying, oh, we should get some runners down. So it's almost occupational health for that first section of where does the dog need to go? How does it function in its day-to-day life? So can the dog walk, sit, lie, get up and down with ease, and travel between toileting area, feeding area, sleeping area around the house in comfort, or is there any problems? And usually by having a look at that, you can then see what the quality of life is like. Okay. Then we'll normally lead into standard set of questions which come across as just normal conversation. So things like, oh, how was your last vet check? Are you on any prescribed medications? Which is always a really good one, because then that's an immediate flag for me. The owners just think, oh, you're being curious of what's going on. Whereas to me, I'm saying, are you taking the dose that was prescribed properly? If you took all of the medication, because owners might not said, oh, it's better after a week, and then I've just not used the rest of it. Or said, I've used up the medication, nothing's changed, so I've just left it and not gone back to the vet. So that immediately, in that first sort of 10-15 minutes, is a good flag for me to go, right, at the end of the session, this dog needs to be referred back to the vet, either for more pain relief, so it can carry out things like the prescriptive exercise we might do, cope even with the massage and the hands-on that I have to do as well sometimes. I mean, sometimes we can't do hands-on if they have behavioural issues and things, and we'll just take it at the dog's pace, but having pain relief on board does help me quite a lot to keep things under control and say, right, pain's sort of decreased, and then strength and sort of muscular activity can increase and support that joint as well as it can. So the owner needs to be on board with that. So that's the first flag that we'll try and get back to you. And then maintenance sessions, like I said, those hour slots, I generally know what's going on. Ask them if there's any changes. Have you been to the vet recently? Have you needed to go back for anything? Has anything changed since last time? Have a feel if there's anything that's odd. So lumps and bumps is a big one. I'm a bit of a lump and bump fiend. Try and document them, keep my eye on them and think, right, okay, it's about 2 centimetres at the moment. If it changes at a rapid rate, we go back immediately. So it's a nice checkpoint, either with lumps and bumps, things like crepitus in joints, swelling, heat, lameness, anything that's out of the ordinary from that maintenance level, it's a flag to go back. So it can signpost them back to the vets really quickly, really easily. So
that's really helpful.
Bit of a long-winded question answer, but it's a big topic.
I feel like most first opinion vets wouldn't really know about, you know, the other side of physio that you can assess, analyze, and also feedback to the vet. I don't know if I had maybe one of your cases potentially that had a lump. Oh no, you were telling us about a case about lump, and then we checked it back again, and we did like an FNA, fine needle aspirate, and then we diagnosed a mass. So it was very useful to have alongside. And you wouldn't pick that up because, you know, the owner is not. Well, some owners are constantly feeling it, but they won't actually think, oh, okay, this is kind of important and you need to go and see the vet.
Oh, so. Absolutely. It's one of those things. I think lumps and bumps is a tricky one because they almost frighten me a little bit, especially when they start popping up at quite a rapid rate. And they are normal, obviously, for dogs of a certain age, but equally, I want to give them a longer life as possible. And if we can catch something very early, like I said, they might have had the lump for a few years and then suddenly it starts to change or grow. That's an immediate red flag. Go back and go and get it seen to. And it can give them, you know, a much longer, healthier, happier life if we get onto it sooner rather than later. So most of my job is signposting back to the vet when appropriate. I said, we're almost like your eyes and ears in the home as well. We can see what's going on behind closed doors, dig into owners' walking routines more, and just check they're following your advice, really, whether it's nutritional, exercise-based, and just be someone who is almost a bit like a counsellor to owners as well. We tend to take on a lot of the information that maybe you can't do in that 15-minute consult. I mean, I can't believe you have 15 minutes. That's completely baffling to me. I've just got in and got me a cup of tea. It's hard, I think, for you as a profession to be able to, if you only see that dog once, twice a year, to get all the information out in that 15-minute consult, it's so tough. So hats off. I think you do really well.
So it's really good to work together, definitely. So I really want to know, like, what actually happens. You know, you explain the conversation that you have and all the information gathering. Like, do you then start like a hands-on immediately, or do you tell people what kind of exercises to do, or you know, how do you do it? Because it sounds like you do regular sessions potentially like every month or every few weeks, or do you just prescribe a set of exercises and then the owner just gets on with it? And how do you make sure that they do it right? You know, things like that.
That's a hard one. Yeah. So I think, given some of the challenges you've got at the moment with cost of living, owners are pushing sessions further and further apart, which makes it really difficult. So as a professional, I definitely went through that phase of, physio's not working, it's really hard, I'm not seeing the improvements, the progress that I've expected. But looking back through however many years, 8 years or so I've been doing this, at the start people would have it maybe every fortnight, and you would see much bigger differences because I'm guiding them at a really good point. It's like going to weight loss camp or something, isn't it? You know, if someone's ringing you up every 2 weeks, you think, oh, I better hurry up. Whereas every month it maybe drops off by week 2. Week 3 is a bit ropey, and by week 4 you think, oh, we better get back onto it. So you have these lulls and this dip. So it can take a little bit of time to get used to. Usually I'll see them every month. Most of the session is hands-on if the dog allows it. So it's always based on the individual.
Okay.
So there's some dogs that I've had really, really good success with, and I've never touched them at all.
Oh, okay.
We can't do because of behavioural reasons. They've got some pain somewhere, the vet's located some pain, and then that's all I've got. I've said it's behavioural case, you've got to be really careful with it, no hands-on, and the owners agreed no hands-on, they don't do it either. So like working dogs, for instance, might be in that category. So as I mentioned, we'll do some functional assessment, so look at gait assessment as much as possible and try and figure out, is a foot landing a certain way, is there more weight bearing on one side of the limb or the dog to the other, and work it out from there. Almost put your detective hat on and try and work it out. So quite a lot of the sessions now are functional based. If I can get hands on, that's brilliant, because then, like I said, about the lumps and bumps, you can feel joints better, you can feel if there's anything that's changed, any swelling, any tension, and you can alleviate it physically. If that's not the case, then we do it exercise based, in which case then we put everything together. So how does a dog sit, stand, lie, move, turn, and then make a big list of like problems that would go on. Okay. And then from those problem lists, pick specific exercises, see if the dog can do them, see if the owner can do them as well, and then guide them how to do it. Like, how many repetitions do you want to do? What are we looking for? What are we going to do next time when we revisit it? And then you go up in stages. So you start off really easy, really basic, so then the dog can be set up to succeed, essentially. So if you give something that's too hard to the dog and say, you've got to be jumping over this jump because you're an agility dog and you need to go and do jumping, the dog might not be able to do that if it has some back pain. So then we say, okay, let's break down that. Can you weight bear on the hind legs? Can you weight bear on the front legs? And then can you propulse yourself up and down? And then can you put it together? So then we might start doing jumping onto a surface and then off a surface, and then you build up to having that movement.
Oh wow.
So we break it down into lots of different stages, and each stage make sure the dog is happy and comfortable to do that. Again, referring back to the pain relief and things like that when it's needed, and then hopefully progress up to full fitness.
It sounds like you're like a gym trainer.
It almost is, yeah. The hardest part is definitely keeping the owners engaged and on board, though. And most of that, I think, does come down to communication. You say, do some sit to stand exercises. And I guess it's the same with us when we go to physio and we say, I've got a really sore knee, I have to do this, and someone says, here's a piece of paper with some exercises, go and do them. If you don't know why you're doing them, you don't do them. And it's getting that intrinsic behaviour into the owners of, I'm doing this because of, and this is what I'm looking for. And again, it's setting owners up to succeed as well. So that's the hardest part of my job.
Oh god.
So yeah, ideally owners stick with the plan. Sometimes it can go a bit awry.
Fair enough. As a pet owner, how do you know when your pet needs physio?
Ooh.
I know from a vet point of view, it would be, the vet would do an assessment, let's say if your dog is lame and come in, but do you have any pet owners contacting you on your website saying that, you know, they feel like their dog needs it, and how do you...
Yeah, absolutely. So quite a lot of people have like maintenance checks, more so horse owners, I think, because they're naturally athletic, because we sit on them, we don't sit on dogs. We tend to have more owners from that field come in and say, I want them checking just to make sure their back's okay, just to make sure, you know, I'm okay to ride them and continue and things like that. And it's more performance and sporting level. For the average pet owner, I don't think they're more likely to do that. They tend to only come to me if there's a problem or if the vet is referring them. So it's less likely. It's not impossible. They sometimes do find it and say, oh, I just want my dog checked. But it's much easier to get things checked before things go wrong. So I'd advise people, maybe when they've got puppies, so it can even be things like, how much do I walk my puppy? What exercises can I do with my puppy to make them stronger? If there's anything that's been found when they are younger, so things like hip dysplasia, elbow dysplasia in puppies, that's a really good time to get onto it really early and almost prevent things. So we've probably all heard the term like prehab, like preventative rehabilitation.
Oh, right.
So prehab's a bit of a buzzword, and that's really good because it's much easier for my job to say, oh, this dog's got really mild arthritis or a really mild change in this joint. We can support it now while the dog's active, rather than wait until that joint is completely degraded and then try and almost reverse something that I can't reverse. And the owner says, oh, I knew it wouldn't work, you know, and they feel really demotivated. Whereas if you can get on it and support them, you can give them a really good quality of life.
I feel like I don't do that enough, especially when you mention puppies, because you know, when a puppy falls down, for example, and then you give a medication and then they get better, and if it's just maybe they just fell down and that's the cause of the problem, then you know you've solved it. But if it was an underlying like hip dysplasia, as you said, or like an early onset elbow dysplasia, anything like that, it makes so much sense that, you know, getting the physio in early enough to help them try and correct that. Do you see that they actually make a difference if you start them really, really young? Yeah, in fact, there's one little case that I've seen who had quite bad hip dysplasia. The owners are really good, they're really on board, had all the hip scoring done and everything like that. It was just one of those things, it's happened, had the x-rays done, and it's got hip dysplasia, it's quite bad. However, they've been so diligent with exercise changes, feeding regime, they're on with the nutrition as well. Weight management is a big one in these sort of cases, so not overloading the joints. And they've done this whole holistic approach of everything, and then I go and check in monthly. We adapt exercises and check the function still there in that hip, and you wouldn't think there's anything wrong with the dog. It's absolutely fine because it's just a lifestyle change. It's a little bit of everything. So in terms of puppies, I think wait for the growth plates ideally to sort of close, make sure the dog's like a little bit more mature, and then I would say have a maintenance session of just, you know, are you looking after this dog correctly? Are you walking it appropriately? Are you feeding it appropriately? How to keep your dog fit for longer? How to keep the joints running for longer? Things like that would be really good. Yeah, and I feel like now there's so much more focus on, I feel like there's more pet owners who are more on board and more proactive in these kind of things, which is absolutely amazing. So you can offer like better care to our patients. So yes, I was wondering about, you know, all the evidence base behind the studies that go into looking at the effectiveness of physiotherapy and including it alongside common conditions. So I'd love to know, you know, what are the common conditions that more vets should know about or pet owners should know about where physio is very, very effective, as well as the evidence base behind it. Because as we mentioned earlier, you know, to some people, physiotherapy in the animal world is something new, but actually it's been going on for a while now. So I wonder, has the research been quite good in this area or still a bit scarce and things? Oh yeah, it is. It's quite sparse, to be honest. We do need more research. A lot of the research we do is extrapolated from the human studies. So human physio has been around for a long time, and we don't bat an eyelid of saying, I'm going to the human physio after surgery. But when we do it for animals, there seems to be this stigma still of, oh, you're pampering them, or it's a bit different, or oh, that's a bit strange. Whereas I think it should be the norm to do that, just like it is for humans. However, the research is quite sparse. It's not robust enough yet. I don't know why. I think purely people just qualifying and like vets, you go into your own practice and you go and do that rather than going to research. And it is slowly changing. There's a lot more sort of students now we're pushing to do the MSc qualification and to do their research projects and then go on and produce these really good studies that we can then share with the world and say, look how good we are. It is slow, but it is progressing. It is coming together a little bit more. We've got big changes in terms of like our governing bodies and regulations and things now. There's more conferences that are all vet physio based, and therefore I think that'll drive some more interest and then more money and funding to get the research out there. So there is some research out there, but like I said, most of it's extrapolated from human studies and then applied onto the animals as well. I believe there was an osteoarthritis study that you mentioned in our last talk. Can you tell us a bit more about that and how useful that one is? Yeah, that one was really nice. So that one I think was by Coast, which looked at arthritis in dogs and different stages and almost like a gold standard of what you should do at each stage. So it went through sort of mild arthritic symptoms all the way up to very severe, and then at what stage you might want to change your analgesics, what levels you might go up to, when to bring in physiotherapy or laser or other different sort of complementary therapies to then help that dog. So I think it was a bit of a guideline, but it's a really nice step in the direction of what we want to do, of just giving vets, I think, a little bit more guidance of when's appropriate to refer. I mean, we're not going to shout at you and say, refer, there's nothing wrong with it, that's quite good. But I think it's just giving you some guidance of
when do you prescribe, in quotes, vet physio to an animal? And as I've already said, the earlier the better. Partly for the owner's education and partly to prevent sort of upset later down the line. There's nothing worse than getting something that's too late. It's much easier to do that preventative side or to help it when it's in the acute phases. So that paper was really good. I wonder if you could put a link or something up.
We'll definitely link it in the video,
because that was one of the nicer studies that I think it was really visual as well, in terms of like the charts of what was going on at each stage of OA, and it might just give people a bit more confidence to then say, right, we're at this stage, which means we could possibly then bring in vet physio now, or laser, or this is what we can do.
And you mentioned qualifications earlier. Just wanted to know, what sort of qualifications do people need to do to become a veterinary physiotherapist, as well as the regulation, because you mentioned some regulatory bodies that are involved. Because I don't know, is veterinary therapist a regulated title?
It's regulated but not protected.
It's
very confusing. Confusing. Okay, so this is probably where almost sort of the old-fashioned view of you have to be human and then go into animals first. That's now changed. So
wait, you mean you have to be a human physiotherapist?
Yeah. So there's a lot of people that believe you still have to be human physio first and then go into animals, which was the traditional method.
Okay.
So you used to be able to do that because physiotherapist is a protected title.
Right.
So that's a human protected title, and you become a chartered physiotherapist, which is for humans. That doesn't then translate into the animal field because it's a newer field. So nothing's come across. So a lot of people, including myself, will be called veterinary physiotherapists. That's not protected, which is really scary. So anyone can get a van, put vet physio on the side and go and drive round. So that's a little bit scary. So we do try and get vets to do the research, invite people in. I know I've done lunch and learns with yourself, so try and get people in to do a lunch and learn. You can even do like a case discussion, a study, and try and drill into the brain a little bit and sort of think, does this person know what they're talking about? Have they done this, to a high enough standard? Have they got any case studies they could share with us and show us if they do have success? Just get a feel for the person and see what you think. Don't be frightened of asking for qualifications as well. So bara's not being protected. The route of qualifications for a vet physio ideally should be a master's qualification, or level 7. So you have different levels sort of from school all the way up. So GCSEs are roughly sort of 3, 4, 5, and then you go up and up and up and up. So master's is level 7, degree level is level 6, and then so on and so forth down. So you want people to be at least a level 6 qualification. And that can be across different boards or different types, but it's essentially a degree level. So anything either degree level or higher it is good quality vet physio. In terms of things like registers and regulations, we do have things that are governing bodies. So this is where you will pay a fee each year and then you'll abide by their code of conduct, a little bit like the RCVS. So you'll abide by doing 30 hours of CPD every year, pay your fee, do your insurance, public liability insurance, everything else, and be a professional. So it binds you to be a professional. There's also voluntary registers as well. So your voluntary registers are things like RAMP or IHPR, AHPR, which you can sign up to say, yes, I'll abide by that as well. So that's the bit that's changing at the moment. We've not quite got something like the RCVS, which is mandatory and regulates everybody, but we're trying to push to get there and try and push for that protection of title as well.
Because it's so important, because you don't want to have anybody rock up and just be like,
that's the thing, that it's getting more and more. So there's a lot more like online courses that pop up, like lowish quality, or maybe they're only like level 3 or level 4, so really low level compared to people that have gone to university and done postgraduate qualifications and spent years doing it. It just gets a little bit mishmashed, because then you've also got things like body workers or massage therapists, which again, I think we all fall into different brackets and we all have our own niches, but it just, because nothing's protected, it just comes under this bundle. And can be very confusing for vets. So my best piece of advice would be, if there's someone who is approaching you or is in the area, do your research, see where they qualified, if it was somewhere reputable, and don't be frightened of asking questions as well.
So to summarize, it sounds like level 7 or master's qualification. It has to be like a university or a specific like college
Yeah, something reputable.
Something
definitely.
reputable, yeah.
Absolutely, yeah.
And especially as you're like a person looking to go into, you know, physio as well, make sure you choose a course. Don't spend money on a course that's like a lowish quality. Like, how do they know that's not great? Just look at the qualification. Look at the
just ask.
Yeah.
You know, try and get like transcripts or try and have a look. So most of the things like on UCAST, you'll have how many credits it is, what level it is will be on there as well, and then your modules and topics.
Yeah.
And you can see which governing body it's sort of attached to, or previous students, and I mean, power of social media now as well. You can always ask in these groups, you know, has anyone done this course? How did you find it? Is it reputable? And just try and get like non-biased opinions on it as well. But yeah, I'd always say go to either like a university or a college, which has been established for a long period of time and, you know, has a good reputation with it as well.
Perfect. Speaking of unqualified people, you know, rocking about doing these kind of things. So on social media and TikTok, you see these animal chiropractitioners online doing, you know, well, it just looks like the dog is really in an uncomfortable position. I don't know if you've seen those videos of like the Rottweiler being in a headlock or something, and then they I don't know what you think about, you know, chiropractitioners. And
I think that's another sort of adjunct, I think, of different types. So you have different sorts of professionals. So you have vet physios, you have chiropractors, massage therapists, body workers, and there's other practitioners like bone therapists, myofascial release therapists, etc., etc. And it goes on. So like I said, I think it can be quite muddy in terms of the water. There are reputable people in every single field. So there's some excellent massage therapists that are brilliant, even that we will refer to help do some like soft tissue work. Chiropractors generally will look more at the mobility in joints. It crosses over quite a lot. So we do a little bit of joint mobilisation as well. They're probably more known for doing that more so than anything else. I think with anything you get good and bad though, and you've just got to look at the whole picture from an outside perspective and say, is that dog comfortable? So using things like your aggression scale and saying, is that dog, where is it up to on that ladder? Is it comfortable? If it's not comfortable, we're as trained just stop and do other things. So like we mentioned, I'd do a hands-off session where we don't even have to touch some dogs if they are uncomfortable or in too much pain. We just do it exercise-based. So I'm very much the school of thought of everything's got to be on the animal's terms and it's individual for that animal. So some animals love the hands-on sections, some don't, so we adjust the session accordingly. So yeah, I think if you ever see a video online and you think, I'm not quite sure about this, I think it's the same with any animal videos.
Yeah, because like when a dog is growling, and the eyes, you know, looking away, looking very frightened expression, but you know, the man is like still holding on to the dog, and you're just like, I think just trust your instinct as a professional. And it's not making a good name for all the other reputable practitioners out there, isn't it?
And that's, I think, the hard bit. And it's the same with vets though, isn't it, as well? You know, you can have some people's opinion of, I don't like them, they didn't communicate well with me, or I didn't like how they acted.
Or vets are money grabbers, that's classic.
They get all that. And then you have vets that do care and do take the work home and really love and care for each one of their patients. So again, I think it's just do your homework, have a chat with them, invite them into practice to do some CPD, or even just, like I said, a roundtable case discussion. You know, I have this case, what would you do for this? And just see what type of answers you get. And
So one of the other questions were about topical issues happening in the veterinary physio world. Are there any at the moment, and what do you think about them?
There's quite a lot. So we've got things like we've touched on about regulation. So having people doing reputable courses and trying to uphold the reputation of the profession. So like I mentioned, it's not regulated, well, it's regulated, it's not protected. So the people that do this work, we're really trying to fight to have our name heard and to be seen by professionals as professionals in their own right. And I think it does get tarnished if people are doing really low quality courses or low quality work, even from reputable courses, and making that work a lot harder for the people that are trying to get out there and say, look, we're flying the flag for this, you know, we're trying to do a good job and get out there. So that's definitely one of them. There has been some work at the moment trying to drive more sort of on the registers and trying to push more towards like autonomy of vet physios. So at the moment we work under what's called the Veterinary Surgeons Exemptions Order. So there's been a few different versions that have come out, which essentially means we have to work under veterinary referral, which I agree with, that's fine. We had a little bit more autonomy where we're allowed to take on maintenance cases without referral if there's no sort of underlying pathologies, and then obviously if you find anything that then gets referred back. So ideally we want to be a little bit more like human physios, where we have a little bit more scope in our practice to be able to do a bit more, and then feedback when we think it's appropriate. So partly because we've done a lot of training, ideally, and yeah, we're insured, we're liable for ourselves, things like that. We want to try and take some of the onus off the vets. So even though it was traditionally like the vet-led team, where the vet's responsible for everything else that goes on in that animal's life, it's a lot of stress, a lot of strain, and a lot of pressure in that 15-minute consult to be able to assess all the other things that's going on in that dog's life. You know, are they going to the hydrotherapy centre that's approved and is regulated and they're keeping up with CPD? Are they going to see a massage therapist and a physio and a chiropractor and everyone else that's in that bubble? So we're trying to take a little bit away from that and say, look, we're fully insured, we're regulated, we're doing our CPD, we're reputable people, please trust us to look after the animal, and if we flag anything, we'll send it back. So that's what we're trying to push for at the moment, and what a lot of the governing bodies that we have are trying to push for as well, to try and help. I think the RVCBS is trying as well to take us under that umbrella, so there's a bit of bish bash bosh trying to go forward and backwards between who gets who and where people go and who are regulated by. But overall, that's something that's quite topical. Obviously, things like welfare is quite big at the moment. So things like social licensing to keep horses, not so much dogs. But yeah, there's a lot of welfare, I think, that's coming up, and people have got their eyes on the industry in quite a big way at the moment. So lots to talk about. Yeah,
and lots of changes as well, you mentioned.
Lots of changes, yeah. So things are changing quite big pace. I think there's a lot more studies coming out now about that. So like I mentioned before, the one with Kevin Hausler that came out in June, July this year, which listed all the problems that the veterinary industry is having as a whole. So things like the prices, you know, people being upset about how much they're being charged, timing, how many people you can fit in, the backlogs that you're having, you know, burnout that professionals are feeling, and it's trying to address how can we use other professionals in the industry to try and alleviate some of that pressure and essentially build a good network of people to help the animal at the end of the day. So I think we're getting there. But change is on the horizon. So
changing gears a little bit about the clinical side of things. What are the common conditions you see mostly, for where you find that vet physio has the most impact?
Massively neurological cases. I think they're a bit scary, I think, for most people. We love them. They're absolutely brilliant. We can do loads for them. As mentioned, because I'm mobile, I go into people's homes, so it might even be things like, this is how you lift the dog up after spinal surgery correctly. So that can be a big factor if they're picking it up, you know, right underneath your surgical site. That's no. You know, support the dog correctly, educate owners on things like harnesses, toileting regimes, keeping the pets clean, preventing infections in like legs, especially from like urine scalding, things like that. So we do a lot of like holistic care in the home for people to try and help them out as much as we possibly can. What else do we do? Fit things like boots or wheelchairs. So we can try and advise on how to correctly fit boots to prevent scuffing and infections in the feet and nails. How to source and try and fit wheelchairs for animals.
Really?
Yeah.
Wow.
Try and get those fitted if the pets needed them at that stage. Trying to get them walking again, obviously, is the main goal. So we do a lot with those types of cases. Orthopedic cases, I think they're brilliant. Things like cruciates are bread and butter. We can get really, really good results in them, and hopefully try and prevent the opposite, like legs from going as well, and taking the strain off that nice and early. So the quicker you get those ones in, the better. And definitely geriatrics and arthritis. That is brilliant. I think you get some really nice results, again, if you get them in early. If they are left a little bit too long, it's more supportive or like palliative care type things with them. But equally, I think you can make big differences to owners' lives by just advising them on how to care for their elderly dog as they get older and change walking routines, the house, feeding, all that thing.
Yeah, because I definitely, you mentioned geriatrics, but in the realm of osteoarthritis, I've read like a statistic saying that, you know, even dogs 5 years old or 7 years old in certain breeds, they start to show signs. Do you see those patients as well, that young?
Oh, absolutely. Yeah, you'll see dogs of all walks of life that have got them. I think especially those active dogs that have it built in their lifestyle to go on like big hikes, big walks, they grumble along for a while, and then all of a sudden you have this big sort of injury that seems to have just occurred out of nowhere, and quite often you can pick it up quite early and get onto that a little bit earlier. yeah, those are really good. So sporting dogs, and also, like I said, arthritis geriatric cases are brilliant for physio and supportive care.
Perfect. How would you explain vet physio to a lay person, like really quickly?
Really quickly. It can help to improve fitness, strength, function, and rehabilitate injuries. That'd be the quickest I could probably do. But yeah, it's a holistic, all-encompassing view of that animal. So regardless of the condition the dog has or presents with, we look at everything. So symmetry, joint range of motion, function in daily life tasks, and then work to improve it as much as possible in every way. So it can involve manual therapies. We've talked quite a bit about gait assessment and functional work, but hands-on work will be some massage techniques, myofascial releases, joint range of motion, and specific exercises that we can do then to build them up, as well as electrotherapies. So I carry usually with me an ultrasound, pulse magnetotherapy, so pulsating magnetic field therapy, a low-grade laser, TENS machines and NEMS machines, so they're a little bit different. So TENS we use for pain, so it helps with your pain gate theory. NEMS is a neuromuscular stimulator, so for the neuro case you can help build muscle by eliciting your muscle contraction. Cool. So there's a lot of things in the bag, and then other bits and pieces as well, the different tools and exercise bits and pieces. So
amazing.
Quite a lot.
Have you ever had anyone sort of like be more of a skeptic and say they don't believe? Yeah, absolutely. How do you deal with that?
Generally the people that have booked you in have some sense of belief, whether it was from them or whether they were referred from the vet and they're a little bit more sceptical of the vet's told me to do this and I don't really want to. It's just that communication and coming across. I find explaining everything that you're doing and what you're looking for gets them on board slowly. So they usually turn out to be the most rewarding clients, by your biggest advocates. If you can turn those people around by chatting to them, explaining them what you're doing and why you're doing it, that's the best thing. So again, having someone who is professional and knows what we're talking about. I always used to say when I had students, stop me at any point and ask me what I'm doing. And if I can't tell you, I shouldn't be doing it. So at every stage, you're going through this process in your head of, I'll apply this machine because it works in this way, or this pathway is going to be affected, and that will be good for this problem. So at any point, what you're doing, okay, that's what we're doing. So owners are the same. I encourage owners to ask as many questions as they want to.
And how quickly do you tell owners to expect a result when they ask you? Like how many sessions do you tend to have before you're seeing results and things?
It depends if they do the exercises, to be quite honest with you. I could go twice a week and probably not see as good a results if I see owners actually do their own exercise prescription every single day. So the better their routine changes are, the better they are on board with weighing dog food out and making sure they're getting the weight off them, or their walking routines change, or they're doing the prescribed exercises. That's when you see the results, and that's the most rewarding thing. So you can usually tell within a few weeks, probably 6 weeks, if you think muscles have to change over a certain amount of time. So think going to the gym. Unfortunately, we don't see results after 1 week. We try, but we don't. It's roughly about that 6 to 8 week mark where you should find things will get a little bit easier. It might not be a big change, but it might be now the dog is sitting a bit straighter, or the dog can now get out of bed by itself, or do an extra couple of minutes on the walk. And it's those little changes owners need to be tuned in for. But
Perfect. What would you tell your previous self about before joining or embarking on this veterinary physiotherapy journey?
What would I tell myself? I think not to worry as much as I did. I think going into this, I've never been sort of a very business-minded person, and that was quite a burden to think, I can't run my own business, I'm never going to be able to do it, I have no background in anything like that. And just having the belief to be able to try something that's new, I mean, even doing podcasts, doing this, is something a little bit different and out of your comfort zone. And make it what you want, make that change in the world, be that little bit of a difference, and just you'll find your own way in terms of your own way of working, your own way of constructing an appointment and a session, your own way of writing notes. You'll have your own way of doing it. You don't have to aspire to be something that you're not. So being true to yourself, being true to your values and your morals. Like we just said about trusting your instincts. If something doesn't look or feel right, it probably isn't. And just going through life like that. I think a lot more positive and assuring in myself, rather than worrying all the time about if you're good enough, and probably imposter syndrome is quite a big thing we have to overcome in this industry, especially working on your own. So I think just trust your instincts a bit more.
Oh, awesome. Can you share a little bit about how you overcame that and how you started your business, if you're happy to share? Like, because you mentioned that you started your business back in 2016 now. And is when a person becomes a physiotherapist, do they have to start their own business? Is that like the only way to, you know, make a living, or do they generally join a team? Like, what does it look like? Because I know as vets, we just go into a clinic or do other jobs, and then we join like a corporate or an independent. But I wonder if there was like such a corporate veterinary physiotherapist or something like that.
Yeah, I think it's changing, and definitely, like I said, a lot of the work I do as well at Nottingham on the course is looking at what students are going to be doing in the future, and like giving them more transferable skills as well. So I think there's definitely more of a push from our point of view at a university to have people that are going into the workforce, no matter what it is. So if they choose to either stay in the veterinary sector or move beyond it into something else, that they have those skills to be able to go and do that. So definitely more emphasis on things like your business skills, people skills, and communication is quite a big thing. And even the interview process, we try and open people up and try and get to know them as a person, see if they have the personal qualities to enter this profession as well. You know, things like being resilient, so like mental burnout and stress, things like that. Can they cope with that? Have they got a good work-life balance? Things like that as well. But yeah, in terms of career progression, I think most people will go and set up on their own. Some have been known to buddy up, so they make friends on the course, or they'll know people in the area, and they amalgamate into like a little team. And definitely now some of the more established physios will be taking on younger graduates to help with the caseload as well. So it's a slow progression, I think, through your journey, building any business, but there are more opportunities coming. I can feel that there's going to be more, and even in-house in vet clinics as well is probably getting a little bit more opened up as well now. So there's a lot more opportunity than what there was, but I do still think a lot of people will go and do it solo. So it just depends if you're clinic-based or if you're mobile.
And can you share a little bit about how much a person can expect to earn in this career, like just roughly? It really depends
how many days you do, and
how many clients you have, isn't it? Yeah.
I'm probably not the best business person, so I'll probably only do about 5 or 6 a day maximum.
Of patients,
it's driving around in between. In the evenings, then you'll write up notes, or you do insurance claims, you're doing all your paperwork, writing exercise plans, writing referral letters.
So you do this all by yourself? You don't have
all
a team?
By myself. I'm the cook, cleaner, everything. We do everything. So that takes up a considerable amount of time at the end of the day as well. So I find that by the time I've done 4 or 5, my brain's not the same as it was in the morning for that first person. And you want to make sure you're giving the same to the first person of the day as you are to the last person of the day. And once I felt that quality had declined, I stopped. So I probably don't do as many as others. I know you could fit a lot more in if you're in clinic or in practice, but then obviously your consult time gets shorter. And then when do you do notes and other things? So it can be quite difficult. In terms of like charging and prices and things, I'm probably on the lower scale, I think, for where we are in the country and people's circumstances as well. So for a dog, the first consultation is around £50, and then it goes down to £45 for your hour consult maintenance. So that's not a lot.
Yeah, and you spend an hour and a half or even an hour, that's a lot of time.
So it is on the lower end at the moment. Might have to change in the future, maybe after this. But I wanted it to be achievable for people to accessible for them, and to add it onto their sort of daily exercises and feel like it was achievable for them to do as well. So probably not the best business person in that respect. So, but you can earn, it varies. Like I said, if you're self-employed, you can work 7 days a week if you want to. You can only work 2 if you want to. It's completely up to you. So it's quite flexible. But it does take a good couple of years to be established. So my best piece of advice is, if you're going into this as well, is to have a part-time job or something to fall back on. Not just rely that once you're qualified you'll open the door and everyone will come in, because it does take a long time, usually by word of mouth, to increase the sales. The first year that I set up business, I spent a lot of money on advertising and it went nowhere. It was all word of mouth. Really? It's a very personal service. So if people like you as a person, they're like, they're really nice, they're really lovely, they fit in with our lives very well, and that's how you get the referrals.
Amazing. And now you're like pretty much fully booked, you
Fairly
mentioned.
busy, yeah, quite definitely this month we're quite busy, yeah. So
When was the last time you had a holiday?
oh, January.
Oh. And we are doing this video in
January.
August, so
Yeah.
you need to have more breaks, girl.
I do. I'm trying my best. The problem is though, you have a break and then I either want to spend it on my own animals or my friends' animals, and then we think, oh, just have a little. I can't stroke animals anymore.
Oh,
so you start
really? You have
stroking
to-
them, you start messing and prodding and poking.
bless.
So it never stops. It's a lifestyle.
It's a lifestyle, but do you find it really rewarding? Like,
I love it. Yeah,
oh.
yeah, I love it. Some of the nicest cases that you see, and yeah, it just brings a bit of happiness to your day when you'll see like a paralysed dog or something, and then over time they'll be walking again, and like you get a video of them running, and you just think, oh, you know what, that's worthwhile. That's something that's brilliant.
Oh,
So,
that's really wholesome.
yeah.
Are there
Love
any
it.
challenges that you face or difficulties that people should be aware about at least before going into this?
Definitely that imposter syndrome.
Oh, right.
So definitely battle with that quite a lot. I think from when you first qualify, you think, I know everything now, I'm going to rule the world, I know everything that could possibly need to be known for vet physio. And then very, very quickly you dive off the other end of the cliff and you go, wow, there's people that have been doing this for many years, they're so much more advanced than me, they're talking about things I've never heard of, what are they going on about? And you'll very quickly as well come across cases that aren't straightforward. So because we look at the whole animal and not just one section of them that's maybe the injury, you might find problems elsewhere because of compensations. So then you think, well, what's going on there? Why is that so? That wasn't the problem on my list. And you have to try and work it out and be a detective. It requires quite a bit of brain power. And unless you're familiar with some of these patterns, it can just baffle you and leave you a little bit overwhelmed, I think. Especially being on your own as well. So
Yeah.
I work by myself. Not having the people or the network to just ring up and say, oh, by the way, you know, what are we doing with this case?
Yeah.
So a lot of the time it's good to have a network of friends or networking with different colleagues as well who may be able to offer a different perspective on a case that you're struggling with and be able to ask and say, oh, should we do that? So definitely imposter syndrome's real.
Yes, it is real. Yes.
Burnout, but I'm probably not the best with that if I've not had a holiday in a while. But yeah, burnout and looking after yourself, making time for you and trying to protect some of the time that you come across. So for me, the odd weekends I have free, I try and go out with friends. I enjoy like pub quizzes, going doing different hobbies, spending time with my own animals, going for walks, things like that. So trying to protect that time and make sure you have that downtime as well is really important when you're really busy. Those are probably the two main challenges.
Amazing. I feel like we've done a whistle-stop tour around the world of veterinary physiotherapy.
Absolutely.
And I really appreciate your time here today,
You're very
sharing your
welcome.
knowledge with us. So yeah, where can people find more of your work and also get involved?
Oh, they can
As
get
clients,
involved. Always things to be doing. Yeah, so at the moment I'm doing some events and things, more like on the horse side. So I did some recently where we painted the skeleton on them and we're doing some movement clinics and things. So you can find out loads about that and everything else I'm up to on my website, which is www.horsestohoundsphysio.co.uk, or on Instagram and Facebook and things, it's at Horses to Hounds Physio. So,
Perfect. Well, thank you so much for listening, everybody, and I'll hope to see you in the next video. Bye.